Thank you, Elizabeth, and welcome everybody. And welcome to those of you that are new today to our series, our webinar series that we've called Conversations with Claire. And welcome to those of you who've been with us in the other one or more of the other three conversations. So for those of you who are new this week, my name is Claire Betker and I'm the president of the Canadian Nurses Association. And I'm a long-standing registered nurse here in Winnipeg, Manitoba, where I have really the distinct privilege of working from my home in Winnipeg, Manitoba, as the scientific director of the National Collaborating Centre for Determinants of Health. And we are hosting these webinars on a weekly basis, really to give the Canadian Nurses Association, our board of directors, our officers, an opportunity to engage with you, our members, and with nurses across the country. And as I'm sure you know, the Canadian Nurses Association is the national professional nursing association representing all categories of nurses. So that includes licensed practical nurses or registered practical nurses as they're called in Ontario, registered psychiatric nurses, nurse practitioners, and registered nurses. And so I'm delighted to be here with you today. But before we begin, I'd like to just take a moment to remember and to honor those whose lives were lost over the weekend in the terrible tragedy and horrific events that occurred over the weekend in Nova Scotia. And as I'm sure you know, some of the victims were members of our national nursing family. In particular, I want to mention Heather O'Brien, who was a licensed practical nurse and worked for VON, Nova Scotia, or Victorian Order of Nurses, Canada, and Kristen Beaton, who was a continuing care assistant also with the Victorian Order of Nurses. But there were other nurses, retired nurses, that were numbered among those victims. And I wanted, we're wearing red today, that in 1 hour at 1 o'clock Eastern Time, we've been asked, I think by the Prime Minister of Canada, Justin Trudeau, to stand in solidarity and to take a pause and 2 minutes. So I'll encourage everyone to do that, and we will be finished this webinar within 45 minutes. But CNA, our officers, our board, and our staff have sent messages of condolences and also sent in solidarity our love, courage, and strength in this terrible time in Nova Scotia. But today, I'm joined by our fourth conversation, an expert from the Public Health Agency of Canada, and her name is Rhonda Kropp. And Rhonda is a registered nurse, and right now she's the Associate Vice President of Infectious Diseases Prevention and Control Branch within the Public Health Agency of Canada. And I know you can only imagine the amount of work and responsibility that Rhonda has within that position within the Public Health Agency of Canada. So we're just absolutely delighted that she was able to find the time from her incredibly busy schedule to be with us here today for this important discussion. So during the discussion, and it is a conversation between Rhonda and myself, I'm going to ask Rhonda to talk about the important role of the Public Health Agency of Canada. And as you recall, the Public Health Agency of Canada was created in the wake of the SARS outbreak in the early 2000s. And so it was anticipated that it would play a very incredible role should there be any large outbreak or pandemic, as we're seeing right now. So she will speak about her role and her responsibilities, about the role of nursing within the Public Health Agency of Canada. But we've also asked her to talk about some of the measures that we will anticipate that are in place right now around physical distancing, social distancing, what we call in public health, the public health measures, and sort of the evidence and guidance that will be evolving as we move through what Michael Villeneuve, I think, called a few weeks ago a marathon, really, as we move together in society. And just sort of a perspective for a nurse that would sit within a federal government agency, and having worked my entire career in the community for the Public Health Agency of Canada, their perspective is on all of society and linking it to that global perspective, and then to the jurisdictional province and territory, and into the local. But just some technical pieces, and I can see that many of you have found the chat box. So I introduced myself, and I'd really like if you would introduce yourself in the chat box. Or for those of us who are part of this conversation, we almost have 100 attendees, which I think is really quite remarkable. And so thank you so much for taking the time to attend today. So if you use the chat box just to introduce yourself and make comments as you want to, you can put questions in there, or resources or things that you have found helpful. Josette Rousseau is helping here today as one of the Canadian Nurses Association staff. So she'll be posting links and posting resources as well. So watch that chat box. It's a way to engage and to be part of our conversation. But there's also a box, if you hover at the bottom of your screen, called Q&A. So we'd like to use that particular box for questions. We see this as a conversation. I'll ask Rhonda a couple of questions that we've got from our polling on social media, the Canadian Nurses Association, that we got from other, the first 3 conversations with you, and put those questions together. So I'll ask Rhonda a few questions, but then really we want to take questions from you and questions from the audience. So use that Q&A box there for those questions, please. This conversation will be in English. However, we are joined, I said her name a minute ago, Josette Rousseau, who is the Executive Advisor at the Canadian Nurses Association, who will be able to either answer questions in French or help with questions in French. So I'd just like to turn it over for a second to Josette, have her introduce herself. So over to you, Josette, to say a few words.
Thank you, Claire. Merci, Claire. Bonjour à tous les participants d'aujourd'hui. Alors, ça me fait plaisir de répondre à vos questions sur tout sujet qui vous intéresse avec la fonction chat ou Q&A qui est à votre écran en bas. Alors, ça va me faire plaisir et puis je vous souhaite une belle session et je vais redonner la parole à notre présidente, Madame Claire Baker. Over to you, Claire.
Thanks so much, Josette. So for those of you who prefer to communicate in French, please feel free to do so, both within the chat box or the question, the Q&A box. And with Josette's help, we'll do our best to answer those questions in French and in your language. So to sort of to get going, nurses are absolutely and will be playing an absolutely critical role in the planning, in the response, and also in the recovery to the COVID-19 pandemic. And it's really staggering to think about its impact on our world, on our work, on our families and our communities, our economy. I mean, it's really incredible to think how staggering the impact has been, but also to think about how we've risen to the challenges that it's put in front of us, both as members of communities and families, but also as an absolutely critical and backbone piece of our health system, both from public health, so case and contact, all the way through to continuing to provide care at home for those that require that care, and all of the settings and parts of that incredible health system we have along the way, including long-term care. So on behalf of CNA and on behalf of myself, I really want to say thank you to all of the nurses, and to say, and I've said this before, but I have never been more proud to say that I am a nurse. So thank you so much from all of us. So CNA, as the collective and collaborative voice, really the voice for nurses and nursing in Canada, has been actively working to provide up-to-date evidence and guidelines and support to our members in a very rapidly evolving and rapidly changing environment. And I had a couple of opportunities to speak directly with the health minister, Minister Patty Hadju, and I found really sobering when she said to me, remember that we've only known this virus for, at that time, it was 3.5 months. So now for about 4 months, it is very novel. It's still being characterized. It's still being, coming to understand what its impact are, how it works, and how we can sort of get, as my esteemed colleague, Dr. Margaret Fast would say, she was a medical officer of health here in Manitoba, how we can sort of get our arms and our hands around this thing, is what she would say. So CNA has been working really closely with the Public Health Agency of Canada. Our CEO, Mike Villeneuve, sits on the Chief Public Health Officers Health Professionals Forum, which has really provided the opportunity for Canadian health professional organizations to come together to provide advice, to provide advocacy if that was needed then, and also to problem solve together around concerns and issues related to COVID-19. And those meetings continue, I think, on a weekly basis. And in the early stages of the COVID-19 pandemic, we did do some polling on behalf of the Public Health Agency of Canada, asking nurses where they would prefer to find information, to find evidence. And we provided that information back to the agency, but also to Minister Hadju. And we continue to do that polling on social media. So look for us on Twitter, look for us on Facebook, and also send any of your information into CNA directly. We would really welcome your input, and use the chat box today to talk to us. So as we look to the next phase of this pandemic, which will include slowly lifting the public health measures such as the social and physical distancing, CNA is committed to continuing to provide support both to the Public Health Agency of Canada, but also to our members, to our jurisdictional members, so those professional nursing associations across our provinces and territories, to our partners, and to also to the other health professionals that we work with, like the Canadian Medical Association, Canadian Association of Pharmacists, Canadian Association of Social Workers. So I'm going to ask Rhonda a series of questions now that we've created, but I really would like you to start to think about. I don't see any questions in the Q&A box as of yet. So I'd really like you to start to think about questions that you might want to ask CNA, that you might want to ask me personally, that you might want to ask Rhonda and the Public Health Agency in particular. So Rhonda, thank you so much again for taking time out today and for being with us. But I'm wondering if for those online, and there's more than 100 now online attendees, I wonder if you can expand a bit on what the role of the Public Health Agency of Canada is, and specifically as it relates to this current, really not been seen for more than 100 years, pandemic situation that we're in right now. Rhonda?
Great, thank you. So first off, I also wanted to share my thoughts and my condolences for the terrible tragedy. And Claire, I want to thank you for opening up the call with that. It's really a horrible situation to have happened, and in this time in particular where folks have difficulty being with others given the physical distancing measures, really appreciate you raising that. I also wanted, just before I answer your question, to send my sincere and honest thank you to all of the nurses who are on the line. And it's really fun to watch everybody checking in and seeing that there's nurses from all over the country, north, south, east, west, who have joined today. I do feel like a member of your community. I feel proud to be a member of that community. I take it very seriously. And I want to thank all of you. It's incredible work that you're doing. And I know how hard it is. In terms of the Public Health Agency and our role, The agency was created, as you said, Claire, exactly for situations such as these. So we have a really important role to play, and I would separate it out into a few different chunks, if you will. The first, I think, is related to the national convening role that we have, and we're very, very lucky in Canada to have a governance structure that is already in place that allows us to get people together really rapidly to come to decisions about how we want to address various things that are happening in Canada. So we have our public health network that was brought together in 2005. We also have the chief medical officers of health that we can meet with. And unlike some of our colleagues in other areas that don't have that structure in place, we're very grateful that we're able to utilize that exactly for situations of this nature. So in January of this year, we were able to bring together the partners that are part of that network to work together on a science advisory committee. And that is a group of folks that are chief medical officers of health and other public health professionals that are coming together at this point at least 3 times a week. And that does not even include the groups that report into them that are the technical and logistic groups, to ensure that we are taking a consistent and appropriate approach together and bringing all of the expertise that we can across the country to bear to the current situation. So that convening role is a really important one, and we're very lucky to have that infrastructure that allows us to do that in a really easy way that works. The second key role we have is looking at that national epidemiology. And for those of you who have been watching the daily press releases with Dr. Tam and Dr. New, they've been giving that epidemiological picture of who are the Canadians in Canada that are really at risk for this infection. What does that epidemic curve look like? We play a very important role in gathering that national picture in partnership with the provinces and territories who feed that data to us. That's another really critical role. The third critical role is on national level guidance, and that is guidance that we put forward, again, to support individuals in the provinces and territories in making decisions regarding how they are going to put those guidance in place within their own jurisdiction. We do not do that work in isolation. That work is done entirely in partnership with provinces and territories and with various professional associations, again, to bring that expertise to bear from across the country. So while we play the convening role and develop some of that guidance, it is entirely informed by people across the country and internationally. Finally, the other thing I would say that's of critical importance is our role in quarantine and border and travel health. So the agency is the regulator when it comes to biosecurity risks, and we are the administrators of Canada's Quarantine Act, which means that any decisions that are made regarding crossing at the border, who is allowed into Canada, and what type of isolation rules, quarantine rules are going to be put in place, those are entirely informed and led out of this organization. So that is another very, very key role that we have to play on that front. So I think I'll stop there, but I think in general, Claire, it's a high-level picture to say that convening role, the guidance, the epidemiology surveillance, and our role in quarantine is also really, really critical.
Thank you, Rhonda. I know it's, I've been in public health my entire career pretty much. You did a great job of making that in a very succinct way with the 4 points. But you're a registered nurse and you're working right there. I think your title right now is Associate Vice President. So you're at a senior leadership role inside the Public Health Agency of Canada. So I think we'd be very interested, especially some of the nurses online that might be starting out in their career. You know, that's a very unique and a very interesting role that you play. So can you just tell us a bit about your role as a registered nurse specifically, and how are you integrating, you thanked the nurses and said you were proud to be a nurse, but how are you integrating that nursing perspective, your knowledge, your skill, your own evidence into your role within the Public Health Agency of Canada?
It is one that I reflect on actually almost daily because I am not certain that I would have the skill sets and experience that I would need to play this role without having been a nurse, at least not play it in the way that I want to. So the role that I'm in now as the Associate Vice President for this branch is really one of leadership and being able to support all of the great professionals that work in this branch that are working on immunization, communicable disease, sexually transmitted infections, foodborne enteric zoonotic disease, our National Microbiology Laboratory, Chief Science Officer, Chief Data Officer. It's a very, very broad spectrum of work within the branch. And I feel very honored to be able to play that role in supporting those professionals in doing the important work they need to do on behalf of the country. My nursing background feeds into that very, very importantly on a number of ways. So the first I would say is the content expertise of nurses is unbelievably important. So when you're working in a position such as the one I'm in, it's important for me to be able to understand the language and the content of the health professionals that I'm working with, both within my branch, but also externally. So I bring that expertise to bear every single day in this role, that content expertise. In addition, the experience. So when you're working at the federal government level, of course, I'm not doing at this point in my job frontline work, but I have done it. So I have a perspective to bring to bear to the conversation that is very much on the ground. So when we're developing guidance or we're developing anything to support the nursing community, the medical community, and even in my case, the lab community, on what we think we should be doing, it's coming from a place of experience and it's coming from a place of having lived it, which I think makes all the difference in the world, because unless you've been in the wards or you've been visiting people at home, it's difficult to understand how and if the guidance we're producing is going to make sense in a real setting in supporting, in our case, nurses here. I would also say that nurses have an incredible skill set related to risk assessment and triage. So when you're working in an environment such as the one we're currently in, there's hardly time to think, much less go to the bathroom or get a lunch. So as we were getting started, someone just ran a lunch into me, which I was so appreciative for. So there's this incredible need to be able to do a very rapid risk assessment and triage amongst a number of different things that need to get done. No one does that better than nurses. And in my experience, when I need something done, I'm going to pull on nurses in the hallway outside here to say, we need to roll up sleeves and do this because we don't have any time and it just needs to get done. So that risk assessment is really, really important, that skill set. And I think the other and the last one I would say that is a skill I think I'm able to bring to this job that I wouldn't have if I wouldn't be a nurse. And that is this degree of real compassionate caring. And that's not to say that others don't have that. There's a lot of caring, wonderful people. But there is something specific to the community of nurses, given that we've chosen to do this compassionate caring role and that we've chosen to have a whole career of service. And I do bring that value that I think I share with the nursing community to this role. There's a lot of, federal government technical things that need to get done, briefing notes that need to go and all this stuff. That's all important. But the important part for me is that there is this lens of compassion and understanding for what is happening on the ground and what's happening for Canadians and for health professionals that I think as a nurse, I bring that strongly to the role, at least I try to. And I'm sure people will tell me if I'm not doing that well. But thank you for that question. I think it's a really important one.
Well, thank you so much for that answer. And it just made me reflect on the Canadian Nurses Association, our board of directors and officers. We're out across the country, coast to coast to coast, talking to nurses about CNA, the Canadian Nurses Association, and kind of our new brand and what role we could play. And, we heard what you just said over and over again, that the compassion and the caring is there, but we bring the knowledge, we bring, I'm going to get tingly here, we bring our science, we bring our capacity to make evidence-informed decisions, to problem solve on the fly and in very acute and difficult situations. And it's really, you said all of that right there, in a government and policy perspective. So well done, well done. And to actually have that clear vision of what you actually bring that's unique to that organization. So just following on that, and I was in a conversation yesterday with some of my colleagues in the National Collaborating Centers, and we were talking about sort of the COVID response and the recovery and those kinds of things. And we found ourselves making a real distinction between policy and practice guidance, and that both were important. They were at different levels. And some of the questions that are coming in the Q&A are asking about plain language and about talking to even nurses who are not used to talking about personal protective equipment and those kinds of things. But it all starts with that guidance, and it all starts with that consistent messaging that goes out. So can you just talk a little bit about how you and your team and the organization finds and pulls and amasses that evidence and then uses it to create those guidance documents, and but also uses it on that evolutionary way on the way forward? Rhonda, just a little bit more about the specifics.
Yeah. Thank you so much. So I'm going to give you a general answer, and then I'm going to categorize it a little bit. So the guidance that we are producing is largely, as I mentioned earlier, produced in consultation and in partnership with a number of different organizations across the country, depending on the focus of that particular guidance. So while we do have expertise internal to the organization, we think it's absolutely critical to ensure that the expertise across Canada is reflected in the guidance that we are producing. So depending on what the guidance is, we have contact with various organizations that we will bring in to ensure they are involved in the writing and the review of those documents. We also have a bit of an infrastructure. So as I mentioned earlier, that governance structure that we have, we're so grateful to have it for so many reasons, but we also use it for the guidance documents that we produce. So we do a bit of a reality check, if you will, with organizations that are closer to the front lines than we are. And from a content perspective, also checking with those folks. And then everything gets shuffled through this governance structure to ensure that folks across the country, not just federally, are really comfortable with what the content is. Now, based on COVID being new, of course, there's new evidence being brought to bear all the time. And that is a really important consideration. So within the organization, we have what is called the Emerging Science Team. And that team is a mixture of a number of different professionals that are scientists and healthcare providers. And they are doing these rapid reviews of evidence as they are coming to the forefront to ensure that we are updating our guidance as it's needed and also informing the decisions that are going forward. So a lot of work being done looking at existing data, but this team is also looking at what is emerging every single day and doing these rapid reviews in order to also support provincial and territorial guidance. It doesn't make sense for all of us to be doing the reviews of the exact same data. So different organizations are looking at to us to say, PHAC, can you please sort of take this on and do some reviews so that we're not utilizing our resources in the provinces and territories in a way that is duplicative of work that's already being done. So from the guidance perspective, I would say that's sort of how we do things. There's the deciding on the priorities together with the provinces and territories. There is deciding on how we're going to develop that guidance with all of our colleagues. And then there is also that governance structure that everything goes through for that final check before it gets posted, as well as this evidence group that's constantly looking at evidence to say, do we still have it right?
Sorry, just trying to get that unmute off. They're a little tricky sometimes, yeah. Thank you, Rhonda. That's an outstanding, I think, description of, you know, a very complex and organizational and partnership model and collaborative model. And I'm just going to say, I think in Canada, we're very fortunate to have that and to have that kind of organization in place and ready to be able to respond. Now, there's a couple of questions, and one is very related to what we had talked about you answering. And it comes from actually from Lori James, who is in New Brunswick. And what she said is, can information, and this is kind of where we were going in a minute, be provided on potential public health measures? So that notion of public health measures be considered as we move towards that opening of the economy or opening of society. And where's the guidance from, what are you anticipating, I guess, from the Public Health Agency of Canada in terms of that, that perspective? And we've also put up a bit of a polling question for those of you online to answer around your overall being right now of your nursing colleagues. But if you could just answer, Rhonda, around those public health measures, of which one is social distancing, one is also quarantine, right? There are others that are in that bundle of what we would consider public health measures. And what are you seeing as we sort of look to the future and out over the summer and into the fall?
Yeah, thank you very much for the question, and thanks, Lori, for bringing that up as well. This is really a very critical point in the pandemic, I would say, not just in Canada, but internationally, as various countries and jurisdictions within those countries are really challenged to figure out, based on the information that we know to date, when do we lift some of those measures to reopen society and relaunch the economy? Critical both to the economics of the different countries, including Canada, but also to ensure that we don't do something inadvertently too soon and then have a resurgence of the work that will take us back against the work we've been doing so well on in Canada. So public health measures, there's a number of buckets of public health measures that are currently in place. The physical distancing that you mentioned, Claire, is a really big bucket because it covers not just the advice of the 2-meter distance, but it also covers all of the measures that have been taken in Canada related to that, which includes closing of workplaces, that teleworking, putting that in place. It includes all of the hygiene, hand washing, all of those good things that we've been telling folks to do. And it includes our borders and closing of different congregate settings that have really impacted the lifestyle of Canadians over the last couple of months. So decisions on how and when to ensure that we're lifting those measures and how to sequence it, because there's so many of them, they're unlikely to be lifted at the same time. Those conversations are again occurring within the context of our existing federal, provincial, and territorial governance structure that we're so lucky to have. Now, we know that the WHO has given some really great guidance on what the conditions should be, what needs to be in place in order for different countries to consider lifting public health measures. And those include things that one would expect, such as the transmission is controlled, we have appropriate public health capacity, health system capacity in place, that we have communities engaged, that are particular vulnerable populations and vulnerable settings, that we are well prepared to deal with outbreaks should they occur in those settings, and also in workplaces. And finally, are we ready to manage importation risk? So these in general are the types of conditions that are being considered, and they are broad. And in order for us to be able to measure, have we reached those conditions? We're working with the provinces and territories to come up with some measures, if you will, to say, you know what, we've actually reached these conditions and we are feeling comfortable to be able to start to lift some of these measures in a phased way. So while this hasn't been completely hammered out yet, I expect very shortly that Canadians are going to hear from us on what that plan is going to look like. But in general, it's going to be based on those conditions and then a set of criteria to be able to say whether or not we've met those conditions. and then buckets of public health measures that will be listed in a particular order, depending on where we are at against those measures. So it's fairly complex, and I think we also need to keep in mind that while we don't have one single epidemic in Canada, we have a number that are occurring in the provinces and territories that are in very, very different places. So while we may have this overarching look at what the conditions and measures should be, we're likely to see the measures being listed at different times in different jurisdictions based on where the epidemiology of the infection is in their particular jurisdiction. So I think we can and should expect that to occur. Yeah, and I think I'll leave it there, Claire. It's a complicated and also a very difficult question because the virus we are still learning so much about. We're dealing with information as it evolves and comes to our attention. So a lot of scanning the literature, a lot of looking at best practices from international partners who are ahead of us in the curve, if you will, and are already trying these things on. And we will continue to learn from that evidence as we go and adjust our way to go depending on what we're seeing.
Thank you, Rhonda. That actually was an excellent answer in terms of making some sense out of, like you say, as a very complex situation. I think Dr. Bonnie Henry, the Chief Medical Officer of Health in British Columbia, said that we have actually 13 outbreaks, right? So, and then you have the federal government within that, in that overarching or umbrella. And then, of course, we situate ourselves in the globe and see how it occurs there. So I think that was an excellent answer. Okay, so we are going to go to our audience, and I'm actually going to call on Josette Roussel to maybe ask one or two questions. We have about 10 minutes left here, maybe 9 minutes left. I think we might have time, Rhonda, for a couple of questions. And just for those of you who've taken the time to type in your question, thank you so much for that. If we don't get to answering them today, we will answer them, and we will make sure that that information is there for you. So Josette, could you read out one of the questions, please?
Yes, of course, Claire. The first question that we've received is in relation to wearing face masks, and the person wondered about the public advice not to wear face masks in the wider community. And when many other countries seem to be employing this strategy, is it around lack of evidence, people not using masks properly, or lack of supply and trying to save masks for the frontline workers?
Thank you very much. Fantastic question and a difficult one. So a couple thoughts. Number one, the public health measures that we just talked about, there's a whole suite of them that we have to think about in a collective. So the role of masks is one of the measures that contributes to the control of the spread of the infection. So Dr. Tam and others, in working with the provinces and territories, looked very closely at the evidence. And in fact, we did one of those rapid reviews that I mentioned earlier to ensure that we had everything that was most up to date. And the evidence shows that wearing masks in public, a non-medical, non-surgical mask, a face covering, can absolutely serve as a benefit to stop the spread of infection from somebody who may be infected to others in the community. It does not serve to protect the person that is wearing the mask. And so in Canada, unlike some other jurisdictions that may have taken a different stance, when we looked at that evidence, we looked at it really in its entirety regarding if we have the ability to stay 2 meters distance from others, is that really necessary? We also had to consider whether or not there is a false sense of potentially protection that is afforded by having on a mask, when in fact the evidence doesn't show that it protects you when you're wearing it. It does protect others. So that's another consideration. And finally, when people wear masks, I know when I wear a mask, there's some fiddling that's going on. You tend to adjust. We're doing our hair. We're doing these types of things. And there's actually some risk associated with that touching that's going on with the mask. So In terms of its benefit for the Canadian society in the context of this current pandemic, as Dr. Tam and others have said, there certainly is some potential to stop the spread from the wearer to somebody else, but there also is the potential for it to serve these other more negative consequences. So hence the recommendation for folks that if they should choose to wear it, it may serve that function, but not to have a broad recognition that people should be wearing these. In addition, the supply, I think, is an important consideration. Frontline healthcare workers for masks are priority, which is another reason why we've been putting out recommendations for the type of face coverings that people can wear. So we ensure that we are keeping medical masks, surgical masks for the health community who really, really fundamentally needs those given the risk that they are taking when they're going into their workplace. So overall, permissive stance on the use of face masks for others with the focus of protecting others from you when you are the wearer, also with the recognition that we don't want to require that for everybody and that there is some risk associated with touching and fiddling with the mask that needs to be taken into account when you're making a recommendation of that nature. So I hope that answers that question.
Thank you. Thanks, Rhonda, and thanks for that question. So we did have a poll that was up. The questions, and I'm going to ask Elizabeth to put the second polling question up. These questions actually come from Rhonda and her team. So the first one was about the overall well-being of nurses. And it looked like, Rhonda, 81% of the respondents said sort of medium in terms of the overall well-being of nurses. And so this one is around unintended health consequences. And as I said, this has come from the Public Health Agency of Canada and Rhonda and from her team in terms of we offered the opportunity to ask the audience these polling questions. So I'm going to ask you in the audience to answer that question right now. I think we have time, Josette, for one more quick question, although I also see that Michael Villeneuve has typed into the Q&A, how can we help Rhonda in her role? And so I'm going to ask people to also use the chat box, Rhonda, to give us some ideas about how they think both our CNA, our partners, our board, our officers, how we can help you in your role. But maybe one more question, Josette, from the list that have been submitted.
Received great questions, and I'm selecting one, but I'm not, it's very difficult to choose the best. There's a lot of questions around Rhonda or maybe Claire. Do you think there will be a need for increased resources in public health, especially nurses, as we are now heading into some new policies and new directions on how to proceed with the social distancing and the policies that will come into play? So maybe hearing your advice of what you see in the foreseen future that could end the webinar, and looking forward to your ideas.
Great. Thank you for that question. It's a really important question. I think, especially as healthcare providers, we have had the opportunity to see this pandemic bring to light where we have some limitations in our healthcare system, and we most certainly have seen that come to bear in long-term care facilities, for example, and I think that there are lessons to be learned from this. So I think I would divide my answer into two parts. The first would be that in the short term, contact tracing and that type of work is going to be intensely important. And that doesn't mean just now into the bottom of the curve, if you will. It's going to remain incredibly important because we fully expect there will be new waves of this to come. So we need to ensure that we are continuing our focus in that very fundamental area of public health measures, if you will, to ensure that we are identifying folks who are cases and doing really, really thorough contact tracing. In that short term, I think there will be a need for ensuring that there is appropriate resources to be available, as I mentioned, as one of those conditions from the WHO, both for public health, but also for the health system. So that's certainly being looked at, and there's been a number of retired nurses who have so amazingly volunteered their expertise and their time to assist in that type of work. But I do think even in the longer term, to your point, there are lessons that we've learned through this pandemic that are hard learned, and I think they are lessons that many nurses have been flagging for quite some time, which is the need to be looking very, very carefully at the ability for frontline health workers to have the resources and the capacity they need to provide the care in the very best way possible. And that can't just be in times of peace, if you will, but also in times of situations such as this, where we are of such incredible importance to the system and to the country that we are not in a position to be able to be in low numbers or incomplete capacity. There is an absolute need to take a look at that. And I think we're also learning about virtual ways of doing some of this work and different ways that we could potentially be bringing our collective nursing expertise to the table during these types of times. So just to summarize, in the short term, absolutely there's a very, very strong focus on ensuring that the capacity is there. I think there are lessons that we're learning that need to be thought about and taken into account as we look towards public health and the health system in the future. And I do think that the lessons that nurses are bringing are fundamental, absolutely fundamental. And I know Claire brought the question forward of how can folks help, and people are answering that in the slide, and I really appreciate it. I think for me personally, what is incredibly helpful is understanding what people are seeing on the ground. What is the experience? What is the experience of healthcare providers? What are you seeing amongst your clients? We're so many steps removed from the type of work that many of you are doing that we really rely on your expertise to hear that. And I know, as Claire mentioned, we have the fantastic opportunity to hear from the Canadian Nurses Association and get their input on the work we're doing. So your input through them is absolutely amazing, and we listen. We really, really want to hear from you. In addition, your expertise is trusted. It is absolutely trusted by Canadians. You are the trusted health professional for them. So we also rely on your expertise and your wisdom and your skill to bring the key messages for how to help Canadians protect themselves and protect others. And we're so grateful to all of you for the work you're already doing on that front.
Thank you, Rhonda. That's an excellent, I think, summary of, and if I go back to where I started this session, talking about the Public Health Agency of Canada being created in response to SARS, one of the recommendations by Dr. Naylor was a sufficient and competent workforce. So we're on that, and certainly that's something that I think we are seeing. And what's happened with this pandemic, it has really scraped away, I think, and we're able to sort of really shine a light on some of the places where things are not as they should be. And I think nurses have a very strong role and a very strong voice in that. So for example, public health for sure, long-term care, home care. There's lots of parts of our system that I think we need to look at. And somebody yesterday reminded me that public health nursing actually was sort of brought into being post-influenza pandemic. So, 100 years ago. So I think we really need to be thinking about this and the role of nurses. And thanks for saying that we're a trusted voice. We're very honored to have that place and humbled by that responsibility. And please let us know how CNA and our valued members can help you in your role. And we're really proud of you. So keep on in there and don't get far away from us. Thanks, Rhonda. And thanks everybody for coming. Next week, we will be talking about Indigenous health. We have we have 3 guests, and I think it will be a really important and a very interesting conversation. So please consider joining us again next week. Thanks, everybody. Bye now. There's a poll on your screen. Please answer it. And thanks, Rhonda, and thanks to your team. Bye, everybody.